Hi, everyone. So for those of you who are just joining us, I just wanted to let you know that we'll be starting in just a couple minutes, right at 2 o'clock. Thank you. All right, welcome everyone. Thank you so much, everyone, for being here. We're going to go ahead and get started. I want to welcome you all to Diversifying the Future of Medicine under the COVID-19 cloud, a virtual convening hosted by the California Medicine Coalition, a fiscally sponsored project of the Foundation for the California Community Colleges. My name is Ariana Morales, and I'm a member of the Coalition's Executive Board and lead the programmatic support to the coalition from its intermediary partner, the Marcus Foster Education Institute. Before we get started, I will be quickly walking us through a few housekeeping logistics for our participation together on both the Zoom and the YouTube Live. So just a few things to note. We are prioritizing cyber safety during this event. All Zoom participants are joining us by invitation only, and so screen share has been disabled for participants. You'll also note that you are muted coming in. This event is being recorded and is also being broadcast live on YouTube. It may be shared in part or in full online later, and certainly the YouTube broadcast will remain on YouTube as well. For Zoom, please note you can also change your name. If you would like to make sure that folks can see you, you can click the Zoom icon labeled participants. A window will appear and click rename. Enter your new name in the new screen name field, and after clicking the blue OK button, your name will appear. For security purposes, we generally don't recommend you use your last name, but that's really up to you. A few other things that you can do to participate today. You can raise your hand in the Zoom to flag us if anything comes up in terms of any technical issues by clicking on the participants button at the bottom, and on the window on the right-hand side of the screen, then click the button raise your hand. You can also react to comments using the reactions, so for the applause or the thumbs up. And for the comments and chat, for both Zoom and YouTube Live, you can use chat and public comment feature throughout the event to share your comments and questions. Our team from the Marcus Foster Education Institute will be supporting the moderators today to select comments to be read during the moderated portions of the event. And any questions for the panel during the panel portion of the event will be selected from the Zoom and YouTube live comments to be submitted once panelists have been introduced. Participation on the Zoom and YouTube, if you can go back to one slide, please. Participation on the Zoom and YouTube live comments will be monitored. So just know that we will be removing anything visually or verbally inappropriate for everyone's safety. So it is now my pleasure to invite our chair of the California Medicine Coalition Executive Board, Dr. Koinis Inix. Dr. Inix.
Alicia Morales, thank you very, very much for your hard work, your tireless effort to make this meeting and several of our meetings a success. I'd also like to express my deepest gratitude to the executive board members who have worked tirelessly with very little reward and have put in so much time. All of us are enormously grateful for each and every one of the executive board members of California Medicine Coalition. Good afternoon and welcome to the 11th convening of California Medicine Coalition. We have a star-studded program in store for you today that will include Chancellor Eloy Oakley of the California Community College System, Senator Melissa Hurtado of the California 14th District, Dr. Sherlyn Cook, President of the Sinclair Miller Medical Association, Congresswoman Barbara Lee, and much, much more. 4 years ago, a group of interested Californians met on the campus of Stanford University to address the problem of inequities and disparities in the health and health outcomes of California's diverse community. We discussed the shortcoming of the supply of physicians, of all physicians across the nation and here in California in particularly. Similarly, we were all made aware of the disparities in medical education. According to the Association of American Medical Colleges, the increase in total US medical school matriculants between 1980 and 2016 was a whopping 27%. That's the difference between 16,587 and 21,030. During that same period of time, the increase in ethnic minorities was only 2.4%, the difference between 11.3% and 13.7%. So then you can see how and when this disparity came about. As you can see here on this slide, we knew where these often forsaken communities were because of the tireless research done by many of the people who were in the room that day. Our stated goal was to reduce health disparities for communities of color in California by increasing the number and diversity of primary care physicians who are trained and ultimately practice in the state of California. Thus, the California Medicine Scholars Program was born. A mission statement was established. The California Medicine Scholars Program is a statewide structured partnership pathway designed to produce underrepresented minority physicians via the California community colleges to reduce inequities and disparities in the health and health outcomes of California's diverse communities. Since 2016, the coalition has convened and drawn on the expertise of its over 200 members and supporters to design California Medicine Scholars Program and its regional hubs of healthcare opportunity. As you can see here, the coalition's primary contributors to the design reflect the wide diversity of California's regions and post-secondary institutions. We reached a momentous milestone just earlier this month when, after 4 long years of diligent, hard preparation, our Senate bill was proposed to and passed by the California Senate Health Committee with an 8-to-1 vote. Here you see the chair of that committee, for whom we are very grateful, Senator Richard Penn. The sponsor of Bill 1110 is Senator Melissa Hurtado, who you will hear from shortly. She's from the 14th California Senate District. Simultaneously, and in collaboration with California Medicine Coalition, Congresswoman Barbara Lee is assisting us in pursuing a grant from the National Institute of Health to address the vanishing number of Black male doctors. We will hear from her shortly as well. If the bill makes it through the additional legislative committees, Senate Bill 1110 will establish the California Medicine Scholars Program as a 3-year pilot program in 4 regions across our great state of California. The California Medicine Scholars Program is a pre-medical pathway pipeline program in partnership with California community colleges and California's medical schools, operated through a statewide office and regional collaborations of higher education institutions and health centers, referred to here, as you see, as a regional hub of healthcare opportunity. Over the past several months, as all of you know, our state, our country, and indeed our world has suffered mightily under the grip of COVID-19. No similar episode in the history of our nation has so dramatically demonstrated the disparities in the United States healthcare system as had the COVID-19 epidemic. In the words of Dr. James Hildreth, President and CEO of my alma mater, Meharry Medical College in Nashville, Tennessee, the heavy toll of morbidity and mortality of COVID-19 pandemic on minority communities is directly linked to the disproportionate burden of chronic diseases they carry. The evidence is clear that access from a diverse provider healthcare workforce would reduce this burden and could have dramatically reduced the devastating impact of COVID-19 virus on these communities. At this time, I would extend my deepest gratitude to our funders. We've had several funders, to our supporters, particularly Marcus Foster Education Institute. And again, I want to thank all of you for having attended today. Thank you, thank you, thank you. And now it is my honor and pleasure to introduce to you Chancellor of the California Community College System, Chancellor Eloy Oakley, who was appointed Regent of the University of California Board of Regents. He's a board member of the College of Futures Foundation, Commissioner, California Future Health Workforce Commission, and co-chair, California Economic Summit. Thank you for attending today, Chancellor Oakley.
Well, thank you, Dr. Enix. Thank you to everybody who is tuned in. We certainly are living in a very interesting, unique, and amazing time right now. And clearly, I couldn't think of a more important topic than to talk about our healthcare workforce. You know, every time I turn on the TV, every time I read the newspaper, it gives me great pride to see the value of our community colleges displayed right in front of us. All the frontline workers that are educated in the California community colleges, from nurses to police, fire, EMTs, the myriad of professions in the healthcare workforce that are trained at our 114 brick and mortar community colleges. So while this is a very concerning time for all of us, it is also a time of great pride to see our very diverse community college students serving us on the front lines every single day and literally saving us from COVID-19. So again, thank you for allowing me to just say a few words, but you know, our community college system is the most diverse system of higher education in the state and certainly in the country, and we take great pride in that. That is a source of pride. It is a point of great value to the state of California. As we educate a quarter of the community college students in the country, it's great value to the entire country. Several years ago, the Board of Governors adopted what we call the Vision for Success, which provides an infrastructure for diverse students from all backgrounds, and I mean all backgrounds, to succeed in reaching their goals and improving their lives as well as the lives of their families and of their communities. The community colleges are the primary entry point for students who want to transfer to a four-year institution, continue to study and pursue a healthcare profession, as well as they're poised to build a diversified student pipeline into medicine and is doing so across the allied health professions. You know, the COVID-19 pandemic, this public health crisis, has heightened ongoing disparities in healthcare and access. I know I'm speaking to the choir here on this topic, but it has really put a spotlight on those disparities and really demonstrated the needs in our communities with healthcare workforce shortages for culturally competent and diverse healthcare workers to improve the quality of care. There is no doubt in my mind, as I'm sure no doubt in yours, that a more diverse workforce, a more culturally competent workforce will significantly improve health outcomes and healthcare in general for all Californians. The community colleges, in collaboration with the other two segments of higher education, are brothers and sisters in the University of California and the Cal State University system, as well as the independent nonprofit colleges and universities. We're well positioned to address these workforce shortages. The community colleges have participated in the California Medicine Scholars Program and continue to support establishing pre-medical pathways through our system in partnership with the Academic Senate of the California Community Colleges, as well as the CSU and the UC campuses, as well as our local health centers across the state. So I think this topic is more timely than ever. You know, before COVID-19, we had huge challenges in the healthcare pipeline. That's why you all have organized yourselves. When this pandemic hit, it really not only highlighted the challenges we face, but exacerbated them. I know I feel the same way you all do when I read the statistics of how COVID-19 has disproportionately impacted communities of color. These are our communities. These are the communities that the California community colleges serve. We need to do a better job. We must do a better job for all Californians. So thank you for partnering with the California community colleges. Thank you for the work that you're doing, and look forward to hearing more about what transpires after this very important meeting. So thank you, Dr. Lennox.
Thank you, Chancellor Oakley. You indeed, as well as all of your institutions, have been wonderful partners, and we will forever be grateful. Now it is my distinct honor and pleasure to introduce Senator Hurtado. Senator Hurtado is the senator from District 14. She's the chair of the Human Services Committee. She's a member of the Senate Health Committee, member of the Budget and Fiscal Review Committee, member of the Governance and Finance Committee, and a member of the Budget Subcommittee number 3 on Health and Human Services. And for us, she is just our wonderful senator who has supported a Senate Bill 1110, for which we will forever be grateful. Senator Melissa Hurtado.
Dr. Enix, this is Ariana Morales. We're just queuing up Senator Hurtado. Just a moment.
Thank you.
While we're waiting for the senator, I would like to invite our executive board members. If one of you would like to share a few words briefly. Oh, let's see. I think we actually might have them on the line. Hi, is Rob Lane, are you there?
I'm here. Can everybody hear me okay?
Yes, I think they can. Most folks are muted. So please, and Rob, I know you are joining us in on behalf of the senator. And so I will let you go ahead and provide your remarks. Thank you so much.
Yeah, apologies for the senator not appearing in person. She's currently in full budget committee voting on the 2020 budget bills, and she sends her apologies to Dr. Enix and everybody else that's joining today. So is now just a good time to get started?
Yes, please. Thank you.
Great. So like I said before, the senator is not able to attend, but she did send some remarks that I would like to read on her behalf. We all recognize that primary care is essential to good health. So everyone in this room, whether it be virtual or not, knows that access to primary care is associated with lower overall health costs, higher patient satisfaction, fewer hospitalizations, and fewer visits to the emergency department. So access to quality healthcare not only has health cost savings benefits, but it should be considered actually a human right. So why is it that every year California projects a doctor shortage? More and more people in our state are waiting longer to see doctors. They travel longer to a doctor's office and are actually paying more for care. This is further complicated, actually, if you live in a rural or poor community. Not only is it harder for you to actually get the care you need, but you're less likely to get the same care as other parts of the state. Why? Simply because of where you live. Why does your zip code dictate what kind of health care you can actually access? This is why Senator Hurtado authored SB 1110. This is why she ran for office. And she told me earlier this morning that this is one of the things that Senator Hurtado plans to fix during her time here in the Senate. So like I was saying earlier, according to a 2017 report from the University of California, San Francisco Health Force Center, California is predicted to see a shortage of over 4,000 primary care clinicians by 2030. So let me say that again. By 2017, California is predicted to see a shortage of over 4,000 primary care clinicians by 2030. This shortage is already severe in rural and inner city areas, especially in Senator Hurtado's district of the Southern Central Valley and the Inland Empire. Patients in these regions face even longer than average wait times to see a physician or an extended time to travel to the closest physician. And many health systems are spending millions of dollars on recruitment. Health plans are trying to find ways to incentivize doctors to move to underserved areas. Some health plans are even covering moving expenses and helping facilitate loan repayment for clinicians. Why do we need to recruit doctors when we could be providing high quality medical education and residency pipelines in these same underserved communities? For example, in Senate District 14, we have brilliant young men and women who are currently getting ready to graduate from college, who are looking to transfer out to an out-of-area medical school. SB 1110 will change this. This bill will, as you know, establish the California Medicine Scholars Program as a 3-year pilot program in 4 regions across the state to support our students from underserved regions to get into a medical school. As you know, this CMSP is a pre-medical pathway pipeline program that's in partnership with the California Community Colleges and California's medical schools. They will be operated through a statewide office and through regional collaborations with health centers or regional hubs of opportunity. This bill will not only be a supportive pathway program for our state's community college students to pursue a pre-med training and enter medical school in California, but it is a key solution to solving the entire state's regional doctor shortage. It's critical that these efforts to increase access to care are driven by the same efforts to increase the number of diverse physicians entering the practice. We must ensure that prospective doctors are from the communities they serve. But how do we do that? This critical legislation. SB 1110, sponsored by you, the California Medicine Coalition, will help bring more doctors to the state and support better access to our community healthcare system and our entire state. This idea really is wonderful, and Senator Hurtado is proud to be your partner in this fight. Unfortunately, as everyone knows, we're in the middle of a pandemic, and this has made the job of the senator and her staff more difficult. We can find ways to connect over the phone. We can do things like Zoom conferences to address health accommodations, but our state budget, as everyone knows, is in trouble. Due to our large budget deficit, every Senate office is being asked to revisit the legislative package with an eye towards economic and COVID recovery. But we all know that our current financial and medical state makes this bill more critical than ever. This crucial legislation provides better access to care and creates jobs, medical careers in her hometown of Sanger and in her Senate district and the state as a whole. So during my phone conversation with the senator today, she said to me, while we couldn't have predicted this current health or economic crisis when she was running for office, Senator Hurtado is still prepared to fight for what is right. Senator Hurtado is still committed to high quality healthcare and jobs, just as committed as when she was running for office. So in closing, she asked me to say, thank you for being my partner in this fight. Together, we will create the California Medicine Scholars Program and make a difference in every community, hospital, clinic, and health provider across the state.
Mr. Robert Lane,
Yes.
I am enormously grateful to you personally. The Executive Board of California Medicine Coalition is grateful to you and the Senator. And I can promise you this, we will not let you down. Thank you.
I'll relay that to the Senator.
And please relay that to the Senator.
Yeah, I appreciate that. You know, I feel terrible that the scheduling just didn't work out well with the budget votes. She's literally on the dais right now, and your words will be very meaningful to her. So she does send her deepest regrets.
Thank you.
Thank you.
Rob Lane. Thank you so very much.
Thank
for
you.
your
Bye.
word. Okay. So now we are going to have the great honor of introducing by way of video. This is a pre-tape recording of our Congresswoman, Barbara Lee. We met with her, approximately a month and a half ago there at her office. She was enormously gracious, and she is a wonderful partner to our effort. And so I can't tell you enough how grateful we are to the Congresswoman. So all of you know her. So without further ado, let's get on with the video.
Hi, I'm Congresswoman Barbara Lee, and I represent California's beautiful 13th Congressional District. I'd like to welcome and thank all of the members and supporters of the California Medicine Coalition. Thank you for all of your individual and collective efforts committed to racial equity, mind you, in the medical profession. I'm honored to speak to you during these challenging times. We have always known that the African American community has been underfunded in public health. However, the COVID-19 pandemic has highlighted more than ever that these health disparities must be addressed. As you know, all around the country, we are seeing a disproportionate amount of African American deaths due to the COVID-19 pandemic. This is tragic. As our communities are being hit harder than ever by the virus, we need to ensure that there is strong African American representation in the medical and science profession. We know that there have been large increases in African American male college graduates in the past 2 decades, but the number of African American men entering medical school has barely increased in the past 39 years. Mind you, that's 39 years. If we're going to keep our community safe and healthy, we need to ensure that their needs are being met with culturally appropriate care. And getting more African Americans into the medical field is a huge part of that. As the COVID-19 pandemic continues to plague our communities, rest assured that I will continue to fight this dangerous virus by ensuring that we have critical funding to not only fund testing, treatment, contact tracing, and care for our communities, but to fight the racial health disparities that this pandemic has highlighted. I will also continue to support strong initiatives for more African Americans in medicine and in science, specifically the lack of African American men. Racial equity is more important than ever during the COVID-19 pandemic to ensure culturally appropriate health care within our community. Just know, as a member of the Appropriations Committee, I'm going to do everything I can do to fund our initiatives to address these health disparities. Thank you all, and have a great conference.
It's clear to anyone who has ever met Congresswoman Lee why she is so beloved in our community and throughout our nation. So we are enormously grateful to the Congresswoman, and we are very appreciative of her words of support. So now I would like to introduce Dr. Sherilyn Cook, who is going to lead a panel discussion today. Dr. Cook is the president of the Sinclair-Midland Medical Association. She is an internist for the Permanente Medical Group. And we are enormously grateful that she has joined our ranks, and she will introduce her panel members. Dr. Cook, thank you so much for joining us today. And we look forward to a wonderful panel discussion.
Thank you, Dr. Enix. I'm very excited to be here today and particularly excited to introduce the panel. And I can say when I looked over the backgrounds of the panel, I was even more excited. I myself am somewhat of a non-traditional medical student. I'm from Compton, California, and I attended Cal Poly Pomona, which is a Cal State school. And I ended up at UCLA and did a master's in public health. And then I went out and worked for 9 years prior to going back to medical school at Stanford. So my path was definitely not a straight line. And we have some outstanding students and doctors here and professors who are also have some very interesting backgrounds that I think uniquely prepare them to address health disparities, particularly in the era of COVID-19. So I'm pleased to introduce first Kevin Gilbert, who is an MD candidate at UC San Diego, Aminta Quiote, who is an MD candidate at UC San Francisco, UC Berkeley Medical Program, and Dr. Javier Galvan, who is a graduate of UCSF School of Medicine, and is also currently working on a master's in public health at Johns Hopkins University, and is also a Soros Fellow. We have Dr. Jana Shengo, who is the Associate Dean of Nursing and Allied Health at the College of the Sequoias in Visalia, California, and Dr. Carolina Quezada, who is the Internal Medicine and Pediatrics Physician and Director of Clinical Education, Family Healthcare Center Network. And she's also Regional Director of Medical Education at A.T. Still University School of Osteopathic Medicine in Arizona. So I'm very excited to have each of these panelists, and I'm looking forward to having them tell their own story. So we're going to start with just a more detailed introduction of each other. I'm going to start with Kevin and have you explain a little bit more about your background, where you're from, and your journey into medicine, and particularly any obstacles and supports that you've had along the way.
Perfect. Are you able to hear me?
Yes. Okay.
Thank you, Dr. Cook. And I'm honored to be able to speak to all of you today. I'm from Pico Rivera, California, which is in East Los Angeles, very close to Compton, California, actually. And so growing up, I always wanted to be a D1 athlete, but unfortunately injuries ended up sidetracking me from that, and I ended up pursuing community college. And in that community college journey, I was still trying to figure out what I wanted to do in my life when two major incidents in my life ended up changing my trajectory. One, unfortunately, was my best friend was murdered due to gang violence. And the second was my grandfather had a third major stroke. And all this happened within the same year. And it really made me think about what I wanted my life to look like in the future and how I can help my communities. And I felt through these circumstances that I wanted to pursue medicine. So I started to take more of my higher education more serious. And at community college, I ended up going to Rio Hondo College and joined a MESA program, which supports first generation and disadvantaged students who want to achieve a career in STEM fields. And I believe they were vital in helping me transfer to UC San Diego. I ended up doing a transition program that helped prepare me for the four-year university, where they taught me how to do research, how to study, and also introduced me to a lot of mentors. And these mentors were vital into me completing UCSD undergrad and also gaining acceptance into UCSD School of Medicine. And so now I'm in my second year of medical school, and I've done a lot of programs in my first 2 years, one of which is co-founding Fade Hypertension with my classmates Emmanuel Keeler and Edgar Vegas. And this is where we would go out to local barbershops in underserved communities and offer free blood pressure screenings and educational resources. This was great because we got to go out and see what the San Diego communities were like. We were able to get them more aware of their cardiovascular health. And also we were able to get the kids more interested in medicine. And then I also was lucky enough to be the assistant director of the University of Links Medical Science Program with Dr. Ramon Hernandez. And this is where we targeted disadvantaged students from the San Diego Community College system. And we enrolled them in a 4-week program where we taught them professional and academic skills. We introduced them to mentors that matched their career goals. And we guided them with our alumni network to help them overcome common barriers that transfer students faced. I'm also part of the Prime Health Equity cohort at UC San Diego. And that's only a few of the things that I've done in my first 2 years. And I'm currently in my dedicated period studying for step 1. But my future goals are to continue with my outreach programs and hopefully foster the next generation of doctors. So, thank you.
Fantastic.
Yeah.
Aminta.
Hi. I hope you all can hear me okay. I apologize for having headphones. There's some construction happening outside that hopefully won't be too loud. So thank you all so much for having me today. Like Dr. Cook said, my name is Aminta Kouyaté, and I am a Bay Area Oakland native and a proud former community college student. I am currently a dual degree medical and master's student studying anti-racism in medical education and health disparities at the UCSF and Berkeley Joint Medical Program. I'm also a scholar in the program in medical education for urban underserved Prime US at UCSF. I'm what you would consider a non-traditional medical student, as I started out in community college and ended up transferring to UC Berkeley, where I studied psychology because my stepbrother was diagnosed with schizophrenia when I was in high school, and I wanted to understand kind of how the mind and body work together to create healthy people. Additionally, it took me several years, both throughout college and after, to gain the necessary clinical experience, and ended up completing a post-bac through the UC Berkeley Extension and then also the California Community College system. I knew that I wanted to go into medicine for a very long time, but it was incredibly difficult to find mentors and also to find guidance and support that believed in my trajectory. Not only is it challenging right now to look at the medical workforce and see representation for Black women in medicine, let alone to find former community college students who are actively in medicine and successful. Additionally, I lost friends to cancer, violence, and drunk driving throughout my community college and college experience, and was also financially, I was working all through college. So I remember in my last semester at community college, I was working 4 part-time jobs and taking 20 units at 3 different community colleges to be able to transfer on time. And all throughout this, it was a combination of people really actively supporting me and people really actively not believing in my path. To the point where I even had a counselor refuse to sign my paperwork to apply for UC Berkeley transfer because he didn't think it was academically viable and wanted me to pursue a more realistic approach. And meanwhile, at the time, I had a 4.0. Due to this, I worked all through undergrad, and I have now, I believe, 8 years of experience working in HIV/AIDS, substance use, food insecurity research, public health, and workforce development, most notably the summer HIV/AIDS research program that I participated in while I was an undergrad, and then actually went on to run for 4 years after, where we helped, very similar to what like Kevin was doing, build up students to be able to be strong candidates for graduate school and medical school. Right now, I am a part of several campus organizations. I am a collaborator for the Institute for Healing and Justice in Medicine, and we just had our inaugural webinar towards the abolishing the use of biological race in medicine. I am a co-founder of the White Coats for Black Lives chapter at Berkeley, where we were just awarded a $61,000 3-year grant to support pre-med pathways in the greater Bay Area, which I'm really excited about. I'm also one of this year's leaders for Freedom School for Intersectional Medicine and Health Justice, and I provide mentorship to many students at all levels in the Bay Area and beyond. And today I hope to be contributing to the discussion as a 2-time community college student. I hope to share like further in the panel my unique perspective on the barriers and challenges community college students face, because I think they are unique and only exacerbated by this current pandemic. And additionally, I hope to express my extreme support for building pathways for underrepresented minority students to get into health and medicine so that they can meaningfully contribute to their communities. Thank you.
Thank you, Amita. Dr. Javier Galvan.
Thank you, Dr. Cook, and everyone for having me. My name is Javier Galvan, and I'm a recent graduate of the UCSF School of Medicine and was also in the Prime US program. I'm the son of Mexican immigrants. I was raised in a single parent household. I grew up poor. My mom did everything she could to ensure our success, but seeing as she didn't have her own proper education, the only goal she had set for us was to graduate high school. So immediately after graduating high school, I decided to enroll or enlist in the United States Marine Corps, where I was a mechanic. And I planned to do that as a career, just as an outlet to get away from the community that I grew up in, the neighborhood. We grew up in like Section 8 housing, so it was unsafe. Luckily or fortunately, right before my deployment to Afghanistan, I was trained to be a combat lifesaver. And that's when I realized that I enjoyed the corpsman's job, which is the Navy, like the Navy hospitalist. I enjoyed their job more than I enjoyed my own job as a mechanic. And that's when the seed was planted to pursue medicine. But at the time, I had no aspirations to do so. And then during my deployment in Afghanistan, which was in 2009, Congress passed the post 9/11 GI Bill. And I remember we had an assembly and all the higher ups told us about this bill and how they would pay for our education. They would give us a housing stipend. And then that was the moment I realized that I should probably pursue something bigger than what I was currently doing. And at that moment, I decided to leave the Marine Corps. I left the Marine Corps in 2010, so I had a year left in my contract, and I didn't want to throw everything I had away. So I enrolled in a community college called Palomar Community College, which was down in near San Diego, or near Camp Pendleton. I think it's San Marcos. And they offered classes on base, and I got A's in both those classes. And it was at that moment that I said that I could definitely leave the Marine Corps and pursue higher education. So I enrolled in a local community college here. I'm from Livermore, California, and I enrolled in Las Positas Community College. And I guess to touch base on some of the obstacles that I faced is I left the Marine Corps. I had no idea what I was doing. I said I was going to pursue medicine. I didn't know what that meant. I didn't know of any medical schools that existed outside of UCSF because they ran the pediatrics department at Valley Care here in Livermore. And I would see their signs on the bus. So I knew that school existed, looked it up, found the admission criteria, printed that out, used it as a guide, but it still wasn't enough because it was vague and they just said they required like a year of biological sciences, a year of physics, a year of chemistry, but it wasn't very specific as to what courses you needed to take. And I didn't know anybody who had gone on to college to know specifically what I needed to take. Fortunately, I was using the GI Bill, and they force you to see a counselor. So I saw a counselor, I talked to the counselor, I asked her, what I had to do, what classes did I need to take in order to pursue a career in medicine. She said she didn't know. I find that hard to believe from a counselor, but nonetheless, she said she didn't know, so then I was on my own. My last semester at Las Positas College, I was fortunate to meet Marcella Anthony over at Stanford with the Health Careers Opportunity Program, and she came to talk about that program. I applied for it. I was fortunate to get it. And it was then that I found the guidance and the mentorship that I needed. And I largely attribute that to being mentorship and guidance from people who look like me, who were eager to, help me succeed. They wanted, the workforce to look like them, to represent California. So then they told me the classes I needed to take, and I met some other people at San Francisco State University that were in the HCOP program at the time. I transferred over to San Francisco State. I was still on the pre-med track. I met with the advisor at San Francisco State, and then they told me that I shouldn't apply into medicine despite having, I don't remember what my GPA was at the time, but it was pretty competitive. And they discouraged me. I applied anyways. I ended up getting into UCSF. I joined under the Prime US program. Another obstacle that I faced once I got to UCSF was how do you finance medical education just because it's so expensive. I didn't know anybody who had gone to medical school or who had graduated from college. So it was all new to me. My first semester, they gave me this financial aid package and included loans. And I remember thinking, this is ridiculous. Like, I'm not going to take out loans to survive. So I returned the loans. I kept the financial aid that they gave me, but it was only enough to pay for tuition. So I had to like skip a couple meals. I started applying for a bunch of scholarships. I applied for Veterans of Foreign War scholarship. They gave me some money. I was fortunate enough, like Dr. Cook said, to receive the Paul and Daisy Soros Fellowship for New Americans, which ended up covering 3rd and 4th year of medical school. And then I was able to finance the rest of my education that way. Like she also mentioned, I was at Hopkins where I studied public health, and I focused on health, finance, and management. And that I was fortunate to be selected as a Sommer Scholar for that. So I also had that covered. Just graduated, I want to say last week on Monday. I'm gonna be an intern at Highland Hospital in Oakland. And then I'll be doing diagnostic radiology or training to be a diagnostic radiologist down at Cedars-Sinai in LA.
Thank you very much. I mean, these, young stories from our young people who are recent physicians and soon-to-be physicians are just outstanding. I'd like to move on to Dr. Jana Shingo to talk about her program, her path into her program, and about being Associate Dean of Nursing and Allied Healthcare, and how her program can assist students like this at the junior college level.
Well, I just want to tell you how I'm humbled to be asked to speak, but more than anything, I'm humbled by the stories, because these are the students that I serve and work with all day long. I do a lot of tutoring at night after my day job is done as a dean. I try to work with students from our colleges in Visalia, California. So we're just down the street from Lemoore. So I understand his challenges, because often they don't get good counseling. I think there's one of the things that we see in the Valley, and I came to the California Community College as an employer. I was a physical therapist for 30 years. I actually graduated from UCSF. And when I moved back to the Valley, back to home to practice. My husband's a physician, also grew up in the Central Valley. We both wanted to come back to our roots to provide medical care. He's an orthopedic surgeon. I'm a physical therapist. And one of the challenges that we saw as employers is that people didn't think they could be doctors. People didn't think they could be physical therapists. All of those were, doctoral level training programs. And even though we had great employees that were working for both of us, they often just had never had high expectations set by anyone. So especially when he mentioned that the counselor didn't know the pre-med pathway, I find that's a challenge sometimes for our students. Also, people are just not, there's an expectation gap. So we just expect you to kind of do what your parents did and grow up and kind of follow that pathway. And I think so many times we just don't have, we don't give our students enough opportunity. So I came to California Community Colleges as an employer who I couldn't fill my workforce needs. So I went to the community college and I said, okay, if people can't go all the way and become a physical therapist, maybe they could become a PT assistant. So what we have found is that providing these guided pathways, so it's not like you have to become a medical doctor immediately, but if you could become a pharmacy tech so that you could work part-time while you're going to medical school, or if you could become a CNA while you're going to nursing school, to try to give students more of a step-by-step process so that the end of the journey doesn't seem so far away. One of the challenges that we have to help our students is just they have to finance their education. So if they have some type of part-time work in the medical field, Scribes is a great place. We try to get a lot of the pre-med students that I work with individually, I try to get them a job in the ER to be a scribe for a couple of reasons. It has great hours. They can schedule it off their school schedule because those jobs are open 24/7. And also that's where they meet physicians. They meet people in the medical field that look like them and kind of have the same story. And so I think at the community college, that's one of the things I'm most committed to is helping students find shorter, more manageable goals so that they stay in that pre-med pathway for the long run. I would say the biggest challenge that I have as a dean is oftentimes in order for students to get into the prerequisite courses, the anatomy, physiology, microbiology, the chemistry classes, These are very highly impacted classes, and often you have to have a pretty high number of units before you can even get into those classes. So one of our big concerns at the community colleges is this, the pipeline is narrow. So we might have we do a lot of recruiting with our high school students. I work on several committees, Health Workforce Investment Board. We have a growing healthcare leaders where we try to tap into our junior high and high school kids, invite them to the college, help them see that there is a pre-med pathway at the community college. But often when they get there, then they're blocked because they can't get into the classes that they need. They need almost 1.5 years or 2 years of other college credits before they're going to qualify to get in, have enough units to be on the, to get into the prerequisites. So one of the things I really would like to see in this group of people is to help us address that kind of bottleneck at the community college, because often I think if students have to wait for 2 or 3 years to get into their prerequisites, they've kind of lost momentum, and they've also used a lot of their financial aid resources almost taking unnecessary classes because they're just trying to get enough units to get qualified for those other, to be able to register for those other classes. So as a dean, that's one of the areas I'm working on, is trying to find guided pathways and then find a legal way to help our pre-med students get into their prerequisite classes earlier. Because the California Community College is the most diverse, because we welcome everybody. We don't say everybody can come, and that's a good thing. But then when you have that many people at the table, it's hard to figure out who to get into what class. So I think that's the strategies that we need like a group of people like this behind us to help identify those pre-med students early, so that we can, not only mentor them. I think the MESA program, we have a Realm grant. I saw Dr. Hurd on the Zoom meeting today, and her husband, Dr. Robert Techo, has left a legacy at the College of Sequoias. I can't tell you how many medical students and math and science students he's mentored as a Hispanic male, and we desperately need to continue his great work at College of Sequoias.
Thank you very much. Dr. Carolina Quesada.
Thank you. Yes, sorry, I was muted.
Oh,
thank
okay.
you. And thank you, everyone. It's amazing to hear all those amazing journeys. And I can share, a little bit of my journey as well. I'm the youngest of 8 children. My dad working in the fields up until a few years ago. He just retired, and grew up in a farm working community where mentorship resources were quite limited. So I struggled a lot when I went off to college. I was fortunate though that I was mentored in college by, I went to St. Mary's College, and there was one of the LaSallian brothers who became kind of like my mentor and guide. And he really guided me to doing a lot of volunteering work. I did a lot of mission trips, and that's where I saw that my passion for medicine, that I could do this. So he helped me write my personal statement, getting that application ready. And so I went to Michigan State College of Human Medicine, and I was very fortunate that at that time, applying for the National Health Service Corps Scholarship Program was maybe not as impacted as now. And I got the full scholarship for my full 4 years. And so after medical school, I went to LA County USC for my residency program. And shortly after that, I came to work at Family Healthcare Network, where I'm still working. And that was to fulfill my commitment for NHSC, but it became my home. And Family Healthcare Network is partnered with A.T. Still University School of Osteopathic Medicine in Arizona. And I became first a preceptor because I knew the importance of mentorship, and I wanted to have medical students that I could, help guide or help teach. And, they keep me on my toes. So I figured this was perfect. And so I became involved as a regional director of medical education shortly after. And then more recently now, I am now the director of clinical education department, where I oversee all the different educational programs here at Family Healthcare Network. Not only do we partner with AT Still, but we partner with many different other programs for PA schools, NP schools. Also, we reach out to high schools to local community college as well, to trying to create some of that mentorship. And now I'm more involved also with Mi Mentor, especially through Fresno State, where I try to help students who are pre-med or are even thinking of PA school or NP school, and trying to helping guiding them and how the application process goes, and getting them, trying to partner them with local healthcare providers, physicians, to try and get that mentorship going as well. In addition, through Mi Mentor, now I've created a kind of network with the pre-med students and our own medical students here at our community health center, because I think if they can create that kind of buddy program throughout their time in Fresno State, then they can help guide them at the whole application process. And all of this is done in hopes of recruiting, mentoring students who are especially of underrepresented minority groups, to try to getting them to apply to medical school, PA school. As far as the medical school, we have a hometown scholar program through AT Still, and so we try to identify pre-med students who are from our area, who have the drive, who wants to work in an underserved community, who want to go into primary care, and we try helping, guiding them and getting them into medical school. Some of the challenges I see as being in this role, though, is once we get them into the medical school, they often struggle because they don't have the resources that other students may have. They sometimes maybe even have to work. They have financial struggles. They have, things that are still happening at home where they need to still be helping out their family. And so these students often struggle. So one of the things I'm hoping that we can create more awareness is, how do we help these students who already have such a disadvantaged background, and we put them into such a high stress medical education system? How do we help those students? How do we make sure that they succeed? And I see that with our students. And so as we go through this and explore what are some of the things we can do for our students, I'm hoping that that's something we can create awareness. And how do we also help them through the process? And then once they complete medical school and are applying for residency programs, one of the things that I see students struggle now with, especially in the osteopathic medical schools, is they need to compete for such a competitive process for residency programs, even in primary care now. So how do we create more GME funding, more GME opportunities within community health centers, within the Central Valley, within maybe even hospitals that are GME naive, so we can create more opportunities. So that's kind of my role and what I'm currently doing.
Okay, thank you very much. We have a lot of questions come in. I'm just going to go back around briefly for each of our students and recent grad. How do you think your background has uniquely prepared you to become more resilient? Clearly, all three of you are resilient to make it through your process so far. But how do you think your background is going to uniquely prepare you to help, particularly in the COVID-19 landscape, in terms of health disparities with patients? I'll start with Kevin, if that's okay. Can you hear me? Can you hear me at all? Uh-oh.
Okay, I was just muted, sorry.
Oh, I'm sorry. Okay.
No problem. So I feel that my background will be able to help me in the future because I'll be able to connect with my patients on a kind of a deeper level. Because I believe patients that are going to be able to see me and see others that look like them, that talk like them, maybe even though we do have our medical lingo, we still have a little bit of a slang to our voice, that they'll feel more comfortable, more willing to share with themselves about their lives. I think that will be a huge benefit of mine going forward. Right now, I am only a second year and I haven't made it out to the wards yet, so I haven't had too much patient interaction, but I will be doing that very soon. And I think at that point, I'll be able to have a more overall understanding of how I can have a bigger impact in the future.
Okay. All right. Amita? She might be muted too.
I'm back now, I think. Yeah, okay. Thank you for this question. I think this is a beautiful reflection question because I think that coming from an underrepresented minority background, I'm uniquely poised to be able to serve an underserved background. I'm from Oakland, California originally, but I moved 12 times before middle school. I know what it's like to transfer both a community college. I know what it's like to struggle, kind of coming up. I tell people I'm in medical school because of lemon bars, because I was walking by an event and they had free lemon bars. And I said, what is this? Turns out it was an underrepresented minority in medicine internship. And that was my first internship that kind of started this all. So being able to express kind of where I'm coming from, to be able to talk to my future patients. And again, Kevin, I'm a rising second year, so this is a little bit of a ways off, but from my experience in clinical research and doing substance use research and HIV testing and connecting with patients, it's really just been about I see you, I honor your experience, I have similar experiences, and I'm here to just help build a trusted relationship so that we can achieve your health needs. And I think people from these communities are the most likely to go back and serve their communities in the future. And I know that that's what my goal is. I hope to eventually go into academic medicine and be a professor at a medical school to be able to teach the next generation of medical students how to be anti-racist medical educators, how to be in direct, to work with communities to achieve their health priorities. So I think, I'm resilient because of who I come from and my people and my community. And I'm looking forward for the chance to kind of get out there in 5 to 7 years.
Great, thank you. How about Javier? I mean, all of you have gone through so many challenges. You're all extremely resilient.
I agree with Kevin and Amita. And if I could summarize it into one term, I'd probably say it's shared experiences. So I'm going to be an intern at Highland Hospital, and then I try to do a lot of my clerkships in underserved areas when I did my third year clerkships. So I did pediatrics and I did OB-GYN at Kaiser Oakland. I did my surgery rotation at Highland in Oakland. And I think the shared experience is what makes us an asset to the workforce, because we understand our patients to a different degree than other people who don't have the shared experience. So sometimes we might label a patient as non-compliant because they're not taking their medication, and we might not, think twice about asking them why they're not taking it. Maybe they can't refill it. There's all these obstacles that come into play with insurance. There's a copay for patients to get a medication. There's a copay for them to come see a physician, right? And if we're trying to prevent these preventable diseases, then I think our healthcare system, it's almost like a financial disincentive to go see a physician for some of these things that we're trying to manage, because we have this copay that, hinders the patient from seeking care or getting their medication. And I seen that firsthand when I was doing my surgery clerkship at Highland Hospital. And I don't want to take too much time, but there was a patient who was not insured. She had a surgical procedure. The chief resident didn't want, or because she didn't have insurance, the chief resident couldn't admit the patient, and they had already sent her down to talk to eligibility and enrollment, and they weren't able to get her Medi-Cal because of a language barrier. Luckily, I speak Spanish. She was also Spanish speaking. I took her down a couple floors. I was able to get her Medi-Cal. We were able to admit her that day, and she was able to have the surgery that she needed the following day, which I think made a difference because I spoke Spanish. I understood the patient, and I didn't just want to send her out into the community like the resident who didn't have that shared experience.
Okay, thank you. Well, we have a few individual questions coming in, then I'm going to circle back at the end towards a big question, but one of them was for Amita. What were the biggest hurdles you faced upon transferring from community college into UC Berkeley? Are you blocked again?
Unmute myself. Yeah, I think the host and I are in an unmuting challenge, so we got it. I think this is a great question because I I was able to kind of, through like advocating for myself and through like connecting with family and friends, trying to figure out how to be successful in community college, I built this really large network. And when I transferred to Berkeley, that was completely gone. I was involved in the African American Scholastic Program through City College of San Francisco, where Doctors Clark, both two of them, were really essential to my success. And once I transferred to Berkeley, you had to wait to get pre-med advisors. That same issue of being able to register for classes when your pre-med classes are 600 plus people and your professor won't even schedule you for office hour because it's impossible to even get in the door. People are like closing elevator doors to try to get in. I think there's a lot of pre-med culture issues that have to change. I think the nature of pre-med advising, both at community college and at the UC level, is very discouraging, not only for students of color, but specifically for community college students. I don't know if I mentioned this already, but there was a professor who said that it would be a waste of an investment to have a junior college student in their research lab when they could have a freshman that they could have for 4 years, even though I had all this work experience because I've been working since I was 16 and I know how to participate and contribute. So all of those things combined with the fact of just feeling really isolated and alone. It's very bizarre to come from a community like Oakland and the Bay Area and then go into Berkeley, which felt so separated from the community. So I really had to work to find different programs. Like there's the Biology Scholars Program at Berkeley. There are the undergraduate research internship with the lemon bars that I mentioned. And being able to kind of slowly build that community was really helpful. But then again, as a transfer student, you have 2 years and then you're gone. So it was kind of this iterative process of gaining community and then losing community that was really challenging. And so it was through finding like mentorship outside of my school that I was able to really be successful. But I don't think that's an opportunity afforded to everybody.
Okay,
I hope that answers the question.
Okay, we're going to move on. We just only have about 5 more minutes left, but I would like to, I know time is flying. I'd like to ask Javier, what is the one thing that you feel made you successful in your quest for medicine? I'm sure it's more, but probably the most prominent thing that made you successful in, graduating with your MD degree.
I think it's participating in HCOP, because if I didn't do HCOP, I wouldn't know what classes I needed to take. I wouldn't know that I needed to take the MCAT, because I also figured out about the MCAT while I was there. And it was there that I found all the mentors that I needed who guided me. I met physicians through my time at Arbor Free Clinic at Stanford who mentored me. They were able to write me letters of reference. They were able to provide the opportunities that you need to be exposed to medicine that don't come easily if you don't have a background in medicine or parents or relatives that know that background. So definitely HCOP.
Okay, so Senate Bill 1110 is going to establish 4 hubs of excellence for engaging the community colleges, universities, medical schools, as well as community health centers to assist students along their journey to becoming physicians. How do each of the students in recent grad, I'll start back with you, Kevin. How do you feel this type of program could have assisted you in your journey?
Okay, I'm unmuted now. I believe this program would be able to assist me greatly because it would give me the mentors that I were so so much needed in my life. I can see someone in a position that I wanted to be in, and I would be able to feel empowered and visualize myself in that career a lot easier than the journey that I took. Also, I feel that with the coalition, I highly recommend building a strong alumni network because I feel an alumni network will be able to kind of give advice for the future generations to come. So that way mistakes aren't repeated and barriers are easier to overcome. And I feel that each of the kind of regional hubs that are going to be going forward are going to have different communities that they're surrounded by. And each of the communities will kind of have unique needs and cultures. Like Central California is going to be different than San Diego and San Francisco. So I feel that these unique communities and cultures, their needs will be met through the regional hubs. But yeah, I think that's going to be the best thing, how the hubs and the coalition will help us.
Okay, Aminta, how could this pathway system, which is what it is to assist community college students to get into medicine, how could that have helped you?
Honestly, I think if this program was around, I would have been done with medical school by now. I think it took me about 6 years to be able to complete my post-bac and get through the application process and start. I think that if this program had been around, I would have been out working in community at this point. I think in addition, I don't want to take up too much more time because I know we're running short, but some things that I think the coalition could really provide to community college students are clinical exposure starting in the first and second year. And a lot of this can actually be done virtually. I think we're doing a lot of clinical skills remotely through Zoom right now, and that's a model that can absolutely be applied at the community college level to get students into either like doing the medical scribing or shadowing physicians, either in person or remotely. I've been participating in phone calls as a form of shadowing, and this program is uniquely positioned to be able to provide that resource to students that is completely, from my understanding, not available to them right now. And I think the other really important thing about this program is that part of this work is changing the narrative about the possibility for community college students from underrepresented backgrounds. Like, I started out as a freshman not knowing at all what I was going to do, and I ended up being accepted to 9 medical schools across the country and scored in the top 10% in the MCAT. And I know that I'm not actually the exception. I just happened to find the right people and find the right mentors. But if this program existed when I was in college, I would know that I would have all my friends would be in here with me, and we're working to support each other, but we really need something like this to help the hundreds of other phenomenal community college students make their way into medicine.
Amen.
Thank you, Javier.
I agree. And I think guidance is the biggest thing. So I had a chance to read the bill this morning just to look at what was being proposed. And I think guidance is probably the most important thing. Like I said, I went to Las Positas Community College. Initially, my first semester, I met with a guidance counselor. I asked for advice. They didn't know what to do. Had this program been around back then, they would have said, hey, look, we have this program. You know, we know these people that are, this is the sole focus is to create physicians for California. This is what you need to do. This is A, B, and C. Had I not been accepted into the Health Career Opportunity Program before I transferred to San Francisco State, I don't know if I could say that I'd be here today, just because even once I got to San Francisco State, I talked to the pre-med advisor and they told me not to apply into medicine. They didn't want to be helpful. And it was really the Health Career Opportunity Program at Stanford who gave me the mentorship, the guidance that I needed to pursue the career that I'm on right now.
Yeah. I just want to comment that I think, you know, coming from a Cal State school, I experienced many of the same things. People who were planning on going to medical school didn't necessarily start at a Cal State school, and there wasn't a whole lot of support for that. So you do sort of meander along your way, and you guys have done an amazing job of navigating this whole landscape, you know, with some help, but not with as much help as Senate Bill 1110 could provide to you. So I applaud all of you guys and thank you for participating. I just wanted to ask Dr. Quezada, any final words about how your program and SB 1110 could assist students in your area?
Yeah, so thank you. I think kind of going along the lines with the students and Dr. Galvan, you know, and trying to provide more awareness and more mentorships, you know, to help the students who already have so many hardships and you know, going through community college and going into either a university, and then of course, you know, into applying into medical school. So providing that mentorship is just so necessary. So I think this will definitely be very, very helpful.
Great. Dr. Shingo?
I agree. I think the whole idea is that I think relationships build pathways as much as the colleges can do things systematically. I also think that we need to connect our pre-med students in the community colleges early. I think we need to highlight that pathway and the great need in our workforce. I think another thing that we find for some of our students, because they haven't had good access to healthcare as a child or as a teenager, this pathway is just not it doesn't even occur to them to go into medicine. And like Amina said, she had all the academic capabilities when she was in community college. Nobody tapped into that. So I think we have to do a better job of just highlighting the pre-med pathway for our students and encouraging people that if they want to serve their, their fellow, family members and people in the community, that we then have a pathway that we can provide that to them. So I think at the community college level, we need to improve our counseling, our guided pathways. Those are the systemic things that we can do. But then I think we also need to find those relationships with local physicians that are dying to mentor someone like themselves or want to provide some clinical hours or, just a scribe in their office or someone that will just help, that we can provide some of those part-time jobs through our own medical providers so that our students can stay on the pathway.
I know we have to wrap up, so I'm just going to make one final comment. When I looked at SB 1110, I think I love the way that it's working from the community college all the way up into the medical schools. I can tell you, as a non-traditional student myself, I was a rarity at Stanford with a Cal State degree. So I think that junior college students, as you said, the potential is there. They have the intellectual aptitude to do it, but there's not necessarily a belief from even the system that these students are appropriate to go on to medicine. And sometimes at medical schools, they don't think this individual is appropriate to come to a medical school with this junior college, Cal State, or whatever university degree, as opposed to someone from a private institution or UC. So I'm glad that it's going to take the approach all the way up, because I think it has to be top down as well as bottom up. So, but thank you so much to my esteemed panel. I really appreciate it. I really enjoy getting to ask these questions. And I'm going to turn it back over to the other staff for the closing. I believe they told me I was out of time.
So, Dr. Sherilyn Cook, I think years from now, when all of us think about today, at least for me, I have been moved and inspired by the students. And that's what I will remember the most. It has been a very noteworthy session, your panel, and I am eternally grateful, not only to you, but for your panelists. And it was just wonderful in every way. I just wish that those students could be around to inspire another generation of students. And I'm sure that, that they'll look to do that. And thank you again. So next, Ariana Morales from Marcus Foster, please.
Thank you, Dr. Inex. California Medicine is so immensely gratified to have been fortunate enough to reach where we are today, particularly given the challenges brought on by the current pandemic. Our success is in no small part due to the generous support of those of you joining us today. As Dr. Inex and Senator Hurtado both noted, I should say the communications director, Rob Lane for Senator Hurtado both noted, we are certainly still in the trenches of navigating the policy process to establish the California Medicine Scholars Program. To launch the program pilot with support from the state, California Medicine is pursuing two parallel paths. First, SB 1110, our policy, and second, a state budget request. For SB 1110, while we have passed the Senate Health Committee, we're now under review at the Senate Appropriations Committee, which must make its decision by June 19th. On the budget side, for that process, we anticipate to be heard in each of the budget subcommittees on health, the Assembly and the Senate, although these hearings will likely not be until July or August as part of what will be called the state's budget June year, which will be happening beyond the recently released May revise. It is now more important than ever that we raise the volume in Sacramento and share the message that investing in a long-term strategy to address the disparities we're seeing today in quality care for minority communities could come hand in hand with immediate COVID-19 relief efforts. So for everyone who is in a position to do so, now is the time to reach out to the leaders of the California Senate and Assembly, the chairs of the Budget Committee, the chairs of the budget subcommittees from each the Senate and the Assembly, and share with them why supporting the California Medicine Scholars Program is important to you, to your institution or organization, and to the communities that you serve and you are connected to. Next slide, please. So we're sharing this quick script. We'll also be sharing this script as well as the information provided on the next slide. You can go to the next slide. Thank you. After today's call with everyone who registered for the event so that you have this information. You're also welcome to snap a picture of this screen now if you would like to save it that way, but you will receive it after the end of this event. I do now want to open it up to our Zoom audience to see if maybe there's one or two of you that's on the line who would just like to offer a brief closing comment, question, or reflection before I turn it back to Dr. Inex to give his closing remarks. Please, if you can use either the raise hand function or the thumbs up reaction button, and that way I can unmute you so that you can share a few thoughts with us. You are also, of course, welcome to chat it in the chat at the bottom today. Dr. Garcia, I've unmuted your line, Dr. Garcia.
Hey, can you hear me?
Yes.
Okay, great. I'm Dr. Ron Garcia, Emeritus Assistant Dean, Minority Affairs, Stanford School of Medicine, past 45 years. And I just have to say, I just feel so passionate about what we are doing that we are really on the brink of making history here, making history on a historical problem for our nation and for our state. It's clear from the presentations that we have tremendous talent. We have these students are very, very special, and they've endured tremendous hardships and challenges to find the success that they had. But I don't believe they're unique. I think there are many more like them. And the method of history that we can make today is through this consortium, this hub, these hubs, this connection. We just don't have that anywhere in our nation. We don't have that anywhere in our state. We have medical schools and programs across the state that have done some wonderful work and have great, great data, but the scale is small. And we have an opportunity to expand that scale statewide. And this is a method for us to do that. We can deal with the issues of stereotyping for students that we are working with. We have an opportunity to build a culture and community of success. Thank you.
Thank you, Dr. Garcia. Dr. Jane Binger, your line is unmuted.
Hi there. It's so inspiring to meet with all of you today. I've been on the coalition exec board now for 4 years since the first meeting at UCSF. And I want to say a personal thank you to our team. And that is Coinus Enix, Ariana Morales, Dan Pellegrini, Ramon Hernandez, Ron Garcia, and Thuy Nguyen. We've worked together now for over 4 years. And just this meeting is so inspiring to me. This is one of the most important things I've done in my whole career. And I'm very blessed to have had a career that's done a lot of really neat things. But the people I get to work with and that we got to meet with you today, it's very inspiring to me. And I love seeing our plotting forward. So we thank you for all the input you give us. We thank you for the courage to keep on this journey, and we look forward to working with you in the future. But please give this whole team a hand because they really deserve it.
Thank you so much, Jane. We so appreciate it. And so finally, before I turn it back to Dr. Cornish-Inix to close us out, I just want to note for everyone that in the chat here, you'll see that there's a feedback form, a Google form that's been shared. And please click that link. You can let us know your feedback of your experience with us today. We'll also be emailing it out after today's convening for you can also access it that way. Thank you so much, everyone.
So thank you, Ariana Morales. I've been spellbound sitting here listening to all of you. I am so inspired. It's amazing, each one of these convenings that we have, I'm a little more inspired after each one. And I had anticipated that perhaps I wouldn't have that same feeling today because of the format. But the fact of the matter is, there have been so many very fine speakers and so many inspirational experiences expressed that I must tell you, I really, really feel good about where we are and where we are going. Just want to extend a special note of gratitude to Alicia Dixon. She is the Executive Director of Marcus Foster Education Institute, and she's been on this path with us from the very beginning. She's behind the scenes in the main, but there's little question in my mind, but that we wouldn't be where we are today without her insight, inspiration, and intellect. And in addition, I'd like to express my gratitude to Dr. Catherine Nation. Now, she's been with us also from the very beginning. Her suggestions have always been welcome. And for her to have been a partner in this has been enormously helpful and inspirational. And so to Catherine Nation and her team at the University of California Office of the President, just want to say thank you. So with that, we can end this unusual meeting, but nonetheless, it has been very gratifying, and I believe it has been helpful. And again, thank you for our speakers. Thank you for Ariana Morales and her team, and thank you for the insight, hard work, and diligence of the executive board members of California Medicine. I'm just filled with happiness at this time, and thank you. So this will end our meeting unless, Ariana, you have some final words to say.
No, that's it. Thank you so much, everyone. We so appreciate having you with us. The meeting is now ending. Thank you. Goodbye.